Welcome to class. I hope that these videos will be short, also informative, and to give you a good overview about the different topics in each chapter. We're going to look at an overview and maybe a little bit about assignments. The course is referred to as Health and Well-Being, and the Well-Being wheel that I'm showing you in this slide is the one that was developed through some work on campus, and it is the well-being wheel that includes 8 dimensions of wellness, as well as the factors that influence our choices, behaviors, and how we can manage those eight different dimensions. So it's easy to say that financial wellness is about saving money, but there are also our socioeconomic conditions, whether or not we have access to health care, whether we have access to health insurance. There are equity issues. There are organizational and public policy. You can get some health insurance through Western, but it does have some cost. And also our living and working environments. So those areas are all involved in influencing our 8 dimensions of wellness. I'm going to look at those dimensions briefly, but the key is that you are not just your physical body, which is one, in this case, 1/8 of that dimension. And you are in the center. How you identify yourself, how you feel about yourself, whether or not you have thought about your self-identity. We'll do a little bit of that this semester. The well-being definitions are described in this slide and the next one. So the social well-being is having a sense of belonging, contributing to an inviting and inclusive community. Emotional well-being is thriving in recognizing that emotions, experiences, relationships are all going to evolve and change and impact our wellness. Knowing how to express our feelings effectively, I think that's an important component. Intellectual well-being is exploring your creative abilities, being inquisitive, developing yourself to be the professional in your field, learning how to problem solve, think critically, but also have balance where you have other outside interests and hobbies. Occupational well-being is finding enrichment in your work, identifying what your talents and strengths are, and your work might be your educational endeavors right now, or it might be balancing school and occupational work. Spiritual well-being is recognizing your meaning in life, your purpose, aligning what your choices and actions are to your own beliefs, morals, values. Financial well-being is related to the skills for managing financial decisions. Environmental well-being is about a sustainable environment, having a healthy environment, living and occupying and working toward having a healthy, how do I want to say this? A healthy place where you live, but you're also concerned about how your decisions influence the greater good. Physical well-being is what you probably assume right off the bat. Sleep, nutrition, sexual relationships, making sure that you seek medical attention when you need it. There are many steps we can take to improve our wellness or our well-being. We can focus on the physical aspect by being active, exercising, eating a good diet, a balanced diet, getting sufficient sleep, learning to manage our stress effectively. avoiding tobacco and drug abuse, and in this case use. Drugs, prescriptions are over the counter, and there are also prescription drugs, but we want to make sure that we use them and we don't abuse them. Limit alcohol consumption, avoid risky behaviors, take care of ourselves, and think critically. Common issues that college students face would be getting enough sleep, managing our stress. We'll take some time to look at those areas specifically, and you'll do some self-evaluations during that time. We're also going to look at how to eat well and how to keep yourself healthy, or I should say infection and virus free. Those are really common issues that many students will kind of go to, but there's other issues that you might be interested in improving. Here's an example of what data we know about sleep. So how do you compare? There's something called the Healthy People 2030. It started with, I think, Healthy People 2010. No, I can't remember. Darn it, I can't remember. It started over 30 years ago, though. And these objectives are made about different areas about our wellness or our health. And one of the areas, every 10 years, they are adjusted or revamped based upon needs. There's baseline data that's collected, and then what's our projection, our target of for 2030. So right now we're in 2022. In 2017, when this data was obtained, 67.5% are getting sufficient sleep. The target is 68.6%. So the desired direction is increased. So about 67.5% of adults all over the age of 18 get sufficient sleep. And this data is collected either through medical evaluations, because some of these are how many people have been tested for. So this one is more of a questionnaire that is voluntarily obtained. Here's another goal: reduce consumption of added sugars by people aged 2 or older. So here we have a baseline of 13.5%. That was the mean percentage of calories from added sugars consumed by persons aged 2 and over for the last amount that, or the last time the data was collected. The goal is to get to 11.5% of calories from added sugars. Another goal of Healthy People 2030 is to address mental health. And this MHMD-05 is just the data about where this is found in this huge document, which is known as Healthy People 2030. The starting value is 64.8% of adults received treatment in the past 12 months, as reported in 2018. What the hope is that more individuals will be screened, assessed, and treated and get that number up. So the intention is to improve the health and quality of life for people that are affected by depression or conditions of mental health. So this class is about a lot of self-evaluation. We're going to do some assessment of a number of ways of thinking about how you see, understand, view these different areas. And we're also going to make a plan about improving a behavior. We're going to hopefully see how these all interact. And then, because this is an essential studies class, we're going to talk about sustainability, have a sustainability lesson throughout the semester, and then do an activity related to food sustainability. And with that, I will see you in the next module.